Welcome back, everyone. It is Wellness Wednesday. We're pleased to have Denise Ware to my left and Cindy Fleming is to her left today. They are certified nurse practitioners with Dr. Kanapali at GI Physicians. We're talking about something I know little about, so I'm excited that you guys are here. We're talking about acid reflux. First of all, tell us what we know about it.
Good morning, Jeff. Thank you for inviting us to come here today and talk to you about acid reflux. Acid reflux is heartburn or an acid indigestion. It occurs when stomach acid or gastric contents are refluxed up into the esophagus through the lower esophageal sphincter, and then can cause that discomfort up in there. And then there's a new hypothesis that is that the esophageal reaction to the gastric content is what causes that inflammation that causes the symptoms we experience.
Almost like it's trying to kick it back out or something. Okay.
Just our response to it, yes.
Yeah, our response. Okay. Risk factors, is there anything? I always think about diet and things I'm consuming. Are there things like that?
Yep, so there's actually 3 subgroups that we have risk factors for. The first one is anything that relaxes the esophageal sphincter. Once that's relaxed, acid can come up and then cause the heartburn. The second one is anything that causes abdominal pressure, increased abdominal pressure, pushing acid up. And then the third one is structural issues that the patient may have that can allow the acid to come up. So with that first subgroup, we have smoking is one. We have citrus juices, like orange juices.
Acidic things,
acidic things. We have caffeine. Nobody saw me with my caffeine drink when I came in today.
My Diet Mountain Dew. Oh,
yes,
no,
yes, and coffee, it's teas. We have chocolate, mint, alcohol, fatty foods, and then there's certain medications such as muscle relaxers that of course relax that sphincter and allow that acid to come up. The second category where the increased abdominal pressure, anybody that's overweight, we see it with pregnancy. And then if you eat a big meal and people will tell us, they bend over, the acid comes
Pushes it up. Okay.
Or they eat a big meal and then lay down, shortly after.
Right.
Then that third category is the structural issues. Some people have a hiatal hernia, the weakness in the diaphragm under the lungs. That stomach can come up a little bit higher. Also, people have had any kind of stomach resection. And then the third one is these little pockets in the esophagus called esophageal diverticulum.
Oh my gosh. Okay. So I've heard people, I've never had it, but I've heard people tell me the symptoms. Talk about those because they're not pleasant, right?
No. And there are many symptoms. Some are one is heartburn. So it's that pressure or discomfort that's right up in the chest area that can move from the stomach or the abdominal area up into the chest. Some is difficulty swallowing or even a heartburn, bloating or nausea and vomiting, sore throat, waking up first thing in the morning with a sore throat or a chronic cough, and some even wake up in the middle of the night with that heartburn or that chest pain. Some are mild, some have severe symptoms. It all just depends on the individual. And we have more. However, we look forward to speaking to you next time on the next session about the diagnosis and treatments of acid reflux.
Yeah, people want to know what they can do to take care of it. Well, thank you, ladies. I feel like I learned a lot about it today. Good seeing you. No way, we'll be back right after this.